Nurse and Midwife Specialist Society of Ghana organized Maiden Biennial Conference 2022 with the theme Investing in Specialist Nurses and Midwives, a Catalyst for Improved Quality and Accessible Healthcare. Speaking at the event was the Dean of SONM University of Ghana, Professor Lydia Slato, said that there's need to focus on the investment training in order for the nursing and midwifery specialists to come on top by developing their skills and to also seek for funding than to depend fully on the government.
So investment in terms of scholarship, as was mentioned by the president of the group, investment as in resources for training, so infrastructure, our skills lab, and everything else that we need to make sure that our specialists come up on top, especially paying those who help in training our specialists. So where do we get the money from if we are talking about investments? It means that our nurses and midwives, specialists themselves, those who are working, because you want somebody to invest in you, how do I invest in you if I don't know what you are doing? So we need to develop our skills in marketing ourselves and what we do. We need to develop our skills in writing proposals for funding. So the education area must get the skills, and you and the field, it is the responsibility of you, the specialists, to ensure that you go out there and seek for funding. And now the world is moving forward. So as we talk about funding, you don't only invest in obsolete ways of treating people or care. You need to invest in modern technology, and by this, it is important to approach it using the multidisciplinary approach where you team up with other professionals so that at the end, your proposal or your funding request can be approved by whichever agency or body you send it to. I also think that it's important for us to invest in human resource development as a whole. So you cannot train a specialist without administrative staff. You can't train a specialist without a driver to take the residents to the field. So at the end of the day, human resource, not only faculty, not only preceptors, not only the residents or the specialists on the field, but the other people that help us to do our work. Sometimes we tend to forget them. The specialists also need higher education. The fact that you are a member today or a fellow tomorrow doesn't mean that you should stay there forever. And therefore, we need the specialist input in training the other cadre of health professionals. So elsewhere, you have specialists having dual appointment in academia and in practice. And therefore, if you want to do this, it means that this specialist sitting here that I see must plan to do something again. You don't stop the wheel after you have become a fellow or a member. It's not enough because you are young, you know, many years ahead of you. So I think that you should plan. Sometimes I heard one of you say the government should take up everything. You know, with the COVID-19 and Ukraine.
Forever. And forever.
We all know that the national purse is becoming smaller and smaller. Okay. So we also need, I believe that we need to make personal plans. We should make arrangements for personal development as you move forward. Is that as we improve and we invest in our nurses, our specialists, and our training, and then other supporting staff, if we do it well and expand training, then any Ghanaian would have somebody who is qualified to care for him or her. Training is not disease-oriented. You don't just assess, diagnose, done, and treat. No. That is not a nurse. So once you call yourself a specialist nurse, don't say you are a doctor. Please. Don't see yourself as a medical assistant. You are nobody's assistant. You are an independent decision maker in the team. Okay? So you are an independent decision maker in the team. Do your work with that holistic eye. That will make you stand out as a nurse. Don't let the nursing tag leave you. And the nursing tag, always keep the nursing process and you win always.
Also speaking at the event was the representative from the Ghana Health Service. In a statement said that the world want to see the nurse specialist that is outstanding by the identity from general nurses within the facility through serious research.
You need to look at what is the standard of practice of a specialist. You should not be looking at staying in one small corner of a ward. That limits your scope, and that will also limit your relevance within the health sector. Now, I call this the journey towards legitimization. Now, this is a great journey that you have embarked on, and bear in mind that it is not an easy journey, where we work in a multidisciplinary setting, where there are different kinds of professional groupings there. And to find yourself as a legitimate member who has some level of relevance and presence within the health service, you should also have something that distinguishes you from the general pool. And so we want to see a nurse specialist whose identity distinguishes him or her from a general nurse on the clinical wards. Also, the work of a specialist nurse and midwife should have an impact on the practice of nursing and midwifery within the facility. For you to become a consultant, you need 3 publications. And to write publications is not an easy thing. And you need to start learning how to do that. So if you are a specialist already, senior specialist, by consultant, you need 3 publications before you can come for the interview.
Speaking at the event was the representative from the Ministry of Health. He urged the nurses and the midwives to work with the consciousness of providing quality health care to the people of Ghana, which calls for satisfying the need to provide direction and agenda for healthcare in Ghana.
We are supposed to provide healthcare, quality healthcare to the people of Ghana. And we cannot do this if we do not invest in our health workers. So we are minded by the 1992 Constitution, and as a ministry, we derive our mandate from the Constitution of Ghana. And whatever we have to do to satisfy the healthcare needs of Ghanaians, we are supposed to do. So it is a good effort for the ministry and the government to come up with this training of specialists. Not only nurses, we have the medical field, we have the pharmacy, and allied health professionals. We are also inspired by the National Health Policy of Ghana, where we provide direction and the agenda setting for healthcare delivery in Ghana. And that also reflects why we have to train specialists. We are also guided by the Universal Health Coverage Roadmap, which we have developed as a country to achieve the Sustainable Development Goal by 2030. So it's something that we are also guided by. And so we have a 5-year nursing and midwifery strategic plan that we work with. And if you look at the strategic plan, there are 5 pillars. And one of the pillars is education and research. And the education and research, we have identified specialist training as one of the key components for postgraduate training. And that is why, in terms of the programs that the Ghana College of Nurses must introduce, we have also identified some priority areas where the Ghana College must focus. And if you see what the management has been doing, led by Madam Hannah Akwa, every time now and then new programs are introduced. And I'm happy that this year new programs have been added. And one of the key programs that we are very much excited on is the infectious disease.
According to the president for Nurse and Midwife Specialist Society of Ghana, Mrs. Perpetual Ofori Ampofo, in an address called on government as the largest employer to prioritize the investing in nursing and midwifery by ensuring more as care specialists.
On every health issue and the development of new medications and vaccines. We therefore call on government as the largest employer and the Ministry of Health to prioritize investment in nursing and midwifery by ensuring more and more of us get specialized.
Therefore, she promised to prioritize the welfare of the members through loans and nurses' funds and to also continue to support the nurse and midwifery within the financial support.
As you all may know or be aware of, we have already instituted the annual payment of professional identification number and auxiliary identification number renewal fees for GRNMA members. We've also rolled out the GRNMA welfare loans. We have the health fund support, the flood and fire support, among many others. We've also enhanced the GRNMA All Nurses Fund and retirement benefits and continue to financially support our regional and district constituents to deliver quality services to members of the association. We will continue to work with our partners within the nursing and midwifery fraternity, as well as other partners in the health sector space, to ultimately ensure that we all are well positioned to provide quality health services to the good people of Ghana and, of course, to our members.